Are you a pharmacy student who's considering doing a PGY1 residency? Well, today we're going to go over a couple different questions to ask yourself to find out if it is a good fit or not. My name is Jenny White. I'm a pharmacist and professor, and I did do a PGY1 residency. And for me, I think it was the perfect fit, and it helped me become the pharmacist who I am today. So, like I said, let's go over a couple questions to ask yourself to find out if residency is a good fit for you or not. One of the first questions that I think you need to ask yourself when you're considering if a pharmacy residency is a good fit for you or not is, where do you want to be in a couple years? What do you want to do as a pharmacist? So if something like community, the retail setting is kind of what you're looking for, there are some residencies now. It's not necessarily as needed in those areas. You can just jump right into working in community and retail for most settings. If it's something like you're interested in working in industry, then something like a fellowship is going to be more for you, and I can do a video on that sometime later. This one is focusing mostly on the PGY1 residency. Or if you're interested in going into management, maybe then a residency isn't necessarily a good fit for you. And the reason why I say that is because when you do a residency, you get a lot more opportunities for maybe a little bit more in-depth clinical experience. So if you're interested in working in a hospital setting, really want to use your clinical skills, maybe you've considered about specializing in something like ER, maybe oncology, you're going to need a PGY1 because a lot of times you actually need to go on to do a PGY2 as well. Another thing to consider is maybe you have an interest in academia, and so that would be another place where a residency is a good fit for you to help you get to experience. You also get to do a lot of teaching usually when you're in your residency, and so those are all things that help you in the long term for being able to move on, kind of like, again, clinical setting, and it's a good fit for if you do a residency. A second question to ask yourself is, do you like clinical problem solving? Do you like clinical reasoning? Is it something that you were on rotation as a student and you got to go on rounds and you absolutely loved it? So in residency, it's basically kind of like your APPEs, but on boot camp. So you're basically a pharmacist, but you still get some assistance and some help and preceptorship and mentorship, whereas you might not get that if you even got like a job straight out of school to get into the hospital. So that is something that is possible, but more and more jobs are starting to require that you have a residency. And it's just because, again, it's a year of very focused, intentional teaching where you get to do different rotations at your hospital. So like for me, for example, I knew that I really liked ER, I liked ICU, I was interested in oncology. And so actually the rotations that I did included ER, ICU, oncology, and then, I had things like med surg, I had internal medicine, I also had transitions of care and ambulatory care. And so it was a pretty vast experience, and so I got to see a lot of cool things. I got to be the pharmacist, but I still was able to ask a lot of questions from my preceptor who was overseeing me. So you get to be on your own, but you still have a little bit of hand holding. And so again, if that's something that you're looking for, it's a great experience for you to get a little bit better on your clinical side and still get some wonderful insight from them, as opposed to, say you get a job in the hospital right out of school, you're probably going to get a little bit of training, but a lot of times, there's maybe you and another pharmacist on staff. You can't really have as much individualized time to get really that one-on-one teaching. Whereas in residency, again, you have like your preceptor who's working that station, and then you're usually the assistant, and then as you continue to progress through the rotation, then you get to be like the main person, and then they're just kind of like double checking your work. So again, if you really want to pursue something clinical, really dive deep into in-depth guideline reviews. When I was a resident, we still did journal clubs regularly. We still did topic discussions. And so again, it was pretty much like my APPEs on boot camp, but I felt like I really got to learn a lot. You get to ask a lot more in-depth questions. And so for me, it was a wonderful aspect to add into my clinical knowledge, where once I got done with those rotations, I actually felt really comfortable with being able to step into those roles. And so that's another thing that I like to encourage students to think about. So In some specialty areas like ER, ICU, antimicrobial stewardship, oncology, usually you have to do a PGY2, or it's recommended to do a PGY2. But in a lot of instances, even just having experienced that during your residency year, sometimes you just will get hired on to do that. So for example, I did oncology as a rotation, but because I got that experience doing it as a resident, I was able to staff at my hospital on the oncology floor if needed. And then that later on helped me get a job working as an oncology pharmacist without having a PGY2. Now, the PGY2 would have helped me significantly because it was a pretty high learning curve. But because I had some experience, I was able to be hired on to do that. And the same with the ER and the ICU. I actually worked at some of the other institutions that I've worked at previously where I staffed in the ER and I staffed in the ICU. It wasn't my full-time gig, but it was still areas that I could work in because I had that experience through my PGY1 residency. And I also know that some of our students that we've had, that they had areas of interest that they did those residencies and they were hired on, especially if there's an opening in that area. A lot of times they're willing to help you grow and to continue your learning, and then you get to step into that role. Now, I also know quite a few people who prefer to do the PGY2 route. So again, I think just doing the PGY1 residency opens up so many doors for you that I always recommend our students to consider and really try to push, because again, so many doors open just by having that one rotation during your PGY1 year, that again, you might be able to get jobs that you didn't think was possible without a PGY2, but it does become possible. Now, don't get me wrong, residency is going to be a very tough year. And so you have to ask yourself, are you ready to have another difficult year? So whether you do a 3-year or 4-year program, I know pharmacy school is challenging, it's tough. And so residency is one more year. Now, I like to encourage students to think of it as you're already in the mindset for learning. You've already gone through 3 years or 4 years of intense learning. What's one more year that is going to set you up for success for the rest of your career? Now, with that being said, residency is a tough year. Okay, so you're going to have projects. You have to do your mid-year project, usually have like an end of the year project, or presentations. They're usually the same project that you're doing over the year, but you might be presenting on it more than once. You're having to do journal clubs, you're having to do topic discussions. If it's a teaching hospital or if you have pharmacy students there, you're going to be doing things like precepting. Like we had to be a part of committees too. So I was a committee chair. There was always something that I was working on for someone, it felt like. And then not to mention you have to do staffing. And so different hospitals require different levels of staffing. We did every other weekend. So that meant that I was 12 on, 2 off. And that was pretty intense. Not to mention all the other things that you're working on, that you're usually at the hospital from morning to later evening, or you're coming home and doing a lot of that work. Now, with that being said, it is a tough year, but again, I don't think that I would be the pharmacist that I am today if I hadn't done a residency. It was like boot camp, like I've said a couple times, but I just know that the growth and the things that I got to see and the people that I got to be around and learn from made all of the difference for my career. And like I said, it has opened up doors where I've worked in oncology, I've worked in the ER, I've worked in the ICU, I've worked in academia now. And all of that I think stemmed truly from being from having completed a PGY1 residency. And I don't think that those same doors would have opened up for me if it wasn't for having done that PGY1 residency. So again, I think you have to think, do you have one more year one more difficult year in you? And the answer, I think, is for most people, yes, you do. You can do it. So again, don't be short-sighted in thinking that like, I just want to be done with learning. You picked a career that requires lifelong learning. And so just choose one more year that is going to set you up for the rest of your life. When you look at things like Indeed or LinkedIn for job applications, you'll frequently see where they say PGY1 residency or 3 to 4 years of job experience or 2 to 3 years, whatever it is. A residency is setting you up for success because they realize like how challenging residency was and all of the experience you gained from it. And it is looked really highly upon. And so again, just choose one more year. You can get through anything. Anybody can get through 1 year of anything, okay? Again, set yourself up for success. And even say, say you didn't go the route of residency and maybe you're in a position that you don't like and you're debating on coming back. Again, it is 1 year that is just going to be challenging, but then sets you up for success. You will have more doors open for you by having completed a residency than by not doing one. You know, maybe you aren't sure right now, but take a look and see what programs are out there, what they have to offer. I think that you'd find that you'll find one that is a good fit for you, and then it's just a matter of doing the application and all that. Don't look back at your career because maybe you got stuck in a position that you don't like, and maybe you don't have as many opportunities because you don't have a residency. So again, I usually encourage all of my students to consider a residency. Now, if again, you're 100% sure that you're gonna like retail or the community setting and that's where you wanna be, then I'm all for that as well. But again, in many instances, I know students who wish that they would have considered residency sooner or prepared for it. And so again, I'm trying to share with you some of the pros and cons to it. It is a little bit heavier on the pro list just because, again, I had a wonderful year at residency and I loved it. And again, I think it made me who I am today. Now, another big question to ask is, can I afford it? And so this ties in pretty heavily to the question that I was talking about before, and can you handle another challenging year? Well, the same can be said. Can I make it happen another year where I'm not making as much money? I just want to make that pharmacist salary, because in reality, yeah, as a resident, you're not making much. You're making anywhere from 40 to 60,000. I think some of the other institutions now are starting to pay a little bit more, but it's definitely a pay cut from what a pharmacist makes. Now, again, though, think about what you were making in pharmacy school. You're probably making no money, or maybe just working on the side to have a little bit of extra spending money. What is one more year to set you up for success, to make multiple doors open for you, to have more job opportunities by taking one more year? I promise you, you're probably not going to know a difference. And again, in the long run, it is going to help you with your career and open up more opportunities. There's different strategies that you can look at for paying back school loans. And a lot of it is based off of your tax income. So don't get me wrong. I understand getting those school loans paid off, making money is an important thing. Believe me, I teach a financial freedom elective at the pharmacy school that I'm at. But again, don't be short-sighted. That residency is going to help you in the future. And so it is just one more year where you're actually making money finally, but you're just not making as much as a pharmacist would from a full-time salary. But again, it is going to open up so many doors for you that I really want you to take a consideration if that 1 year would be worth it, because I think it would be. Now, I touched on this a little bit too in a previous question, but how do I learn best? So as I mentioned, with residency, you are the pharmacist now because you get your license, you pass your NAPLEX and the MPJE, but you're actually still getting some assistance. And if you really thrive under mentorship and guidance, I think residency is a good fit for you then, because you have the opportunity to spend a little bit more time with a preceptor, get to ask questions, you'll see different areas of learning. And now I know that that is what the intent of APPE rotations are, and it can be hit or miss though. Some people love their APPE rotations, and then other times you might be wishing that they were a little bit more robust, or maybe you didn't quite get the ones that you wanted. So by looking at hospitals that you're interested in doing residency, then you can see, again, maybe you didn't get into ER or ICU, but you really were wanting to. Well, now's your opportunity, and now you get the guidance of the pharmacist to help you. So you're still making decisions, but you get that guidance. Now, if that doesn't sound good to you and you just kind of want to be essentially thrown to the wolves, and you're kind of like a figure it out on your person, okay, then maybe it's not going to be a good fit for you. And then, working your way up in the hospital is a good long-term decision, but that's not the case for many people. And I really appreciated having the insight and the mentorship and guidance from my preceptors on residency, and again, really helped me to grow. Now, a couple other things that I think people don't consider about with residency is all of the other opportunities outside of even like pharmacy that we necessarily think of. So like my residency, we actually had teaching certificates, and I've realized pretty quickly when I was precepting students that I enjoyed teaching. I was able to get like my teaching certificate. I had to do a CE lecture for physician assistants and nurse practitioners, which I really ended up liking. And that has served me well because obviously I'm in an academia setting now, but I actually do CE lectures for a company on the side as well. And so they pay for me to travel and I get to teach pharmacists about stuff that I really enjoy. So again, that was something that doing a residency opened up for me, and it has been a really good fit. Another thing that was unique with my residency is actually we did mission trips. And so like for me, I personally got to go on a surgical mission trip to Guatemala, and it was an amazing experience where we got to give back to the community. We had a surgical team. It was me and another pharmacist. We had quite a few nurses, and then we also had like physical therapy there because we had and we had additional staff who were helping with fitting patients with wheelchairs. We were able to give them, medications. They were able to do a lot of different surgeries. And for me, that was such a life-changing event. And you just get to see how appreciative we are for the way that we live here. And again, it was just a wonderful opportunity. One of my co-residents, she actually got to do a trip to Haiti where her and another resident were actually helping with like teaching their staff a little bit more about how we do our hospital, how we do some of the things in the hospital by us. They got to teach them on different disease states. And so mine was only a week long, but I think my co-resident ended up staying for about 4 weeks. And so again, there's so many opportunities within residency. Find the one that's a good fit for you. Like I found a wonderful residency. I made wonderful friends with my co-residents. I'm still in touch with most of them. And so I've just got to see them grow and progress as pharmacists. It has helped with opening up other doors, and we've made other connections. And so again, I can't speak highly enough about my residency year, and I encourage you to consider it. Maybe in your P1 year, P2 year, I don't know what it is, but if you haven't considered a residency, I hope that this video is helping you and has maybe answered some of your questions. If you have additional questions, feel free to drop them down below in the comment section, and I'd be happy to answer them. Again, I can't speak highly enough about my residency year. It was a challenging year. It was difficult, but it was 100% worth it. And again, I would do it in a heartbeat. So hope you guys enjoyed this video, and I will catch you on the next one.